A more contagious and deadlier COVID-19 variant that ravaged India is spreading throughout the United States and is likely to become the dominant strain of the virus, threatening widely unvaccinated parts of the country like Alabama. This is a very contagious variant, so it has a competitive advantage against some of the other viral strains, and there's also concern, not definitively documented, but a real concern that if you get infected, you are more likely to have a severe disease, said Dr. William Schaffner, professor of infectious diseases at Vanderbilt University. So far 13 cases of the Delta variant have been identified in the state, according to the Alabama Department of Public Health. Alabama has the second to lowest vaccination rate in the country. Just 31.5% of the population was fully vaccinated as of Friday, according to the CDC. That's ahead of only Mississippi. The number of vaccines given each day in Alabama has been dropping since a peak in April. Experts say the existing COVID-19 vaccines remain effective against the Delta variant, but people who have not been vaccinated are at risk. UAB had only 14 COVID-19 patients in the hospital as of Wednesday, and all of the hospitalized individuals were unvaccinated, UAB epidemiologist Rachel Lee said in a press call on Wednesday. She said she is concerned that the Delta variant could cause another COVID-19 spike this summer among the unvaccinated. Depending on these transmission patterns and how susceptible we are to the virus. And, with low vaccination rates, I would be concerned that we could see another surge of cases, she said, urging unvaccinated people to continue to wear masks. But Schaffner at Vanderbilt said that a large surge is unlikely, despite the fast-spreading variant. I think too many people have been vaccinated so far for that to happen, but you could have local outbursts of infection, said Schaffner. He noted that the population is fairly spread out in many rural areas in states like Alabama with lower vaccination rates. That may be an advantage to preventing spread. David Montefiori, a virologist at Duke Medical Center, lamented that many of the people most vulnerable to the Delta variant, those who have not gotten a vaccine, are the least likely to recognize their own risk. They really need to take this seriously, and their risk of getting infected more seriously than ever before, he said. The Delta variant is gaining in this region, remarkably fast. Alabama's political leaders have shrugged off the idea of offering incentives to increase vaccination rates, as many other states have done. Alabama Governor Ivey, during a stop in Orange Beach on Wednesday, remained noncommittal toward the idea of an incentive to boost the vaccination rate. She jokingly asked a reporter, "What do you want to offer?" when she was asked about the issue. Ivey then added, "It's a matter of personal responsibility. We won't mandate everyone to get vaccinated."